Welcome to Advancing Health. The evolution of age-friendly health initiatives continues to spread across our healthcare landscape. In this podcast, we learn more about how to plant them deep, help them grow, and measure their success.
My name is Marie Clary Fishman. I'm a senior advisor to the president of Health Research and Educational Trust, nurse by birth at this point in life, and I'm really happy to be here to talk with these great folks this morning from Northwell Health. And we are going to have a conversation around large-scale initiatives such as age-friendly and implementing that within a hospital or healthcare system. And it can also apply to other patient safety initiatives that you or your organization might be working on. So I am honored to welcome our guests today. We have Michele Frankel, who is the Regional CFO, Chief Financial Officer. And then we have Susan Kwiatek, who is the Vice President of Aging and Supportive Care, and also in charge of the Institute for Healthy Aging. So I'm going to turn to Michele and Susan, and I'm going to ask you to introduce yourself. Tell us a little bit about your roles because they are so special in your organization. And then we'll go on and have a little bit of discussion about the things that you have found to be such priorities and that have really helped you be successful. So Michele, do you want to start?
Sure. Thank you for having me. I'm Michele Frankel. I'm currently the Deputy Market President for the Eastern Market of Northwell Health, which encompasses 8 hospitals and a couple of hundred ambulatory practices. But for the majority of my career, I've been in a variety of finance roles, and most recently, the Regional CFO for the Eastern Market. In that capacity, I'm responsible for managing the budgets of these institutes and implementing strategy and business plans to support this strategy in order to ensure that we are able to provide the services to the communities that we serve. And I've been lucky enough to be involved in many big scale initiatives, one of which was the Institute for the Aging and expanding that initiative across our organization.
That's great, Michele. Thank you. Susan, would you like to do the same thing?
I'm Susan Kwiatek. I'm the VP for Aging and Supportive Care. I'm a nurse by background, and I have been working in the age-friendly space since 2019, and more recently in the Institute for Healthy Aging that we recently launched last year.
So you've both mentioned the Institute for Aging. Let's start just by having a bit of a conversation about how that came to be. Who started it, who brought it in, and how did it get brought to life in your organization?
So when we began this work in 2019, we began by rolling out the IHI 4M framework. And as we rolled this out from hospital to hospital and standardized practices, we quickly realized, and when I say we, the executive leadership, and in particular, Dr. Maria Carney, who was our chief of the Division of Geriatrics and Palliative Care at the time. And she really had this vision that we have to back this up to healthy aging, and that we also need to expand our efforts to caregivers. And that really is what gave birth to the recognition that we need an aging institute so that we can really cover caregivers and cover healthy aging as well.
And that's a great example of how the C-suite and leaders were involved from the very beginning. So I think that's important. Michele, I'd just like to call out a little bit and ask the question about what involvement the CFO, either you or local CFOs, what kinds of responsibility or involvement did they have in bringing the Institute for Aging to life?
So once the journey started, Susan had reached out to me for support in putting quantitative metrics around a return on investment on this initiative. And we worked closely together on the types of metrics that would be a result of this initiative, of which included reduction in length of stay, reduction in falls, reduction in readmissions. However, when Susan and I spoke, thankfully we had a long history together, working together, so we knew how we needed to get to where we wanted to go. We recognized that there were multiple initiatives going on in the health system that impacted all those very same metrics. So we had to really narrow down the population of who we were looking at to compare those specific metrics relative to the patient demographic and diagnoses that these patients had. So Susan and I worked together with our back-end data analytics and finance team to pull the data in the right way and to begin to show the first site where we rolled this out, the improvements that were had, and to tie dollars to them.
So we've done this analysis 3 years in a row, and we've seen the same trend with the top 3 DRGs, and that is reductions in length of stay for sepsis, for respiratory infections, and for heart failure and shock. We were able to then put what the cost avoidance is for the length of stay reductions in all of those 3 DRGs. And then it also frees up beds. So it also contributes to efficiency.
It's great. I hear those steep criteria being brought in there: safe, effective, efficient, equitable, patient-centered, and caregiver-centered care. So I think that's very exciting. So you two have a really strong connected relationship between a clinical role and more of a finance or marketing engagement kind of role. And I'm just curious, like, what's the glue that really keeps pulling the two of you back together and in this kind of work? Because I think that there's something special there.
As I mentioned, my history in this organization is in finance. And I'll say that the majority of it up until 2008 was in what I'll call back-end finance, really, churning out numbers and analysis, not in hospitals, not face-to-face with where the patient care is being provided. And my first job in a hospital was where Susan at the time was the chief nursing officer. And I went in as the site CFO, and I had never worked inside of a hospital before. So I had a lot to learn, and I really learned all I know about nursing in a hospital from Susan. And Susan eventually became the president of that hospital as well. So we worked very closely together, not just on budgets every year for the hospital, but on new programs and new initiatives and how we would build up business plans to support what the hospital was trying to accomplish, whether it be for a new program or for efficiencies and cost savings without compromising care. And I think that the glue for Susan and me, and in general, whenever we're working on a project, is that finance and clinical and operations, we all need to work very collaboratively together and really listen and hear from the other parties what is needed. And then the finance person can help translate that into a business plan to advocate and get, the mission accomplished in a cost-effective way.
Susan, anything you want to add to that?
We really learned to speak each other's language. So Michele took the time to learn all about nursing, whether it was nursing, physical therapy, dietary, radiology. She really took the time to learn what it really takes for those departments to operate efficiently. And I learned from her how we really can work with the finances to make the staffing plans effective.
I mean, you're getting at the idea there of walking in each other's shoes, right? Not just doing your part and walking away, but really figuring out what is it that makes the other person tick? What do they need? And if we want to use the 4Ms, we can say what matters to each of you, right? You've taken the time to find that out. And I think that's really important because everything else goes through that lens. So living what we're practicing, right? And that's really, really important. How are you continuing to keep the Board of Trustees engaged in this activity? It sounds like they've been very involved and very supportive. How are you keeping that spirit going and that alive so that you continue to get the support needed for this work?
First of all, the board is very involved and very engaged in knowing what our metrics are. What's our patient satisfaction? What are our quality issues? What's happening at each of the hospitals? And we're accountable to report metrics up to the board. an example that I can give you is that we've really been reducing length of stay, reducing readmissions, increasing the patient satisfaction, and in several of our hospitals in the patients age 65 and older. We know that we've always done well with patient satisfaction, but not so much in the older population. So we've really put a focus there, and we're seeing those scores improve as well. We also have hospitals, and one in particular, the example, the early adopter, that started out by implementing the 4Ms, started out with niche recognition, which they're at exemplar now, magnet with distinction, geriatric emergency department accreditation at the gold level, and then to the Baldrige Award at the national level. So this is really all examples of what the board wants us all to strive for and looks closely at.
Well, congratulations on all those achievements, and that's a great success. So thank you for sharing that. Let me ask a question about frontline engagement. Can you tell me, how does the frontline get to experience the involvement of the board or the C-suite? How does that get to the folks that are actually doing the hands-on care?
So I think there's a lot of communication upward and downward in our organization. The frontline staff know that the board is looking at dashboards, and they also know that the board is approving budgets. All budgets go to the board on an annual basis. And I know that they feel it in this way as well, because the involvement is there. Also, there was an aging summit that was held, and there were people from all levels of the organization invited to that summit. And we had board members present for that.
Oh, that's great. That's another nice idea of how to engage folks and get them to meet each other. So that's terrific.
And I'll just add to Susan's point is the way our organization is structured lends itself to the vertical communication. I mean, we're a very large organization. We span a pretty large geography. But in terms of the mission and the priorities and rolling out initiatives, we have a structure in place that goes regionally, market-based geography, and then within our market structure, then we have a way to communicate to our hospitals. And then within each hospital, there's a communication pathway down to all the frontline workers, clinical and non, many times together. And then in addition, there's rounding that goes on the floors on a regular basis of senior leadership, both from the hospital and the market and the system, to, ensure that everybody's engaged and, singing from the same song sheet. So there are many mechanisms of communication vertically.
That really gets to the issue of culture, right? And how you have alignment. The other thing that it gets to, which, my colleagues all laugh at me, is I frequently say structure plus process gives us outcome, right? So you have structures in place and then put those processes. But I think that's a really important point. And if we're missing that structure, we may have all the processes in place, but if we don't have structure, which can mean staffing, the right people in the right place, the right equipment, all of those things, then we can do all we want with process and we're still not going to quite get to our outcomes. So really important point.
To that up-down process that Michele just described. But for age-friendly, we have a specific process for age-friendly as well. We have our age-friendly teams at each hospital. The steering committees are the executive leadership of each hospital. And then the age-friendly teams have people that report into a collaborative care council where they are sharing best practices and presenting on them and presenting their PDSA cycles. And then that committee has a leadership that reports to executive leadership of the health system. So it's really a robust process.
So I'm going to ask one last question, and that is, if you were with another organization, what would be one action item that you could say to the leaders of another organization? If you do this, you will find success with the work you're doing. And I know narrowing it down to one is kind of tough, but what would be that really important one thing that you'd like to say to folks?
I think that no matter what you're trying to accomplish in an organization, it requires a wide array of experts in different parts, whether it be clinical, operational, financial, board level, executive leadership. And I think that everyone has to recognize that they need to listen and learn from the rest of the stakeholders to really understand the what, the why, and then we can all work together on who and how we get things done to achieve what we're trying to achieve. And I think, even though we're such a large organization, we have pockets of experts in all of these arenas. And if you leverage all the right people, we can really accomplish anything.
Well said. Susan.
I would say that age-friendly is a team sport, and every discipline in the healthcare organization needs to be involved, since that's really along the line of what Michele said. The icing on the cake then is when you have leadership support.
Well, congratulations on all the great work that you're doing, that you've done and continue to do. We've talked about some really important concepts here that everybody should think about. Age-friendly implementation doesn't happen in a silo, just as both Susan and Michele said. And I think that if we really want to engage this and make it part of the culture, we have to think about those things. We have to think about governance and the involvement there. It's really, really difficult to move a large-scale initiative like this forward without that governance engagement. And that includes, of course, the C-suite as well, engaging with the board. So that's really critical to the success. I think the other thing we talked about today a little bit is system design, right? You need to be conscious and think about how are you putting your system together? How does that work in your organization? And that builds on culture. I think that's really important. The next is the care delivery. And that's really where the 4Ms come into play. That's a care model for taking care of folks that are aging. In the 4Ms work, it is 65 and older. But as we think about aging, this model, when we talk about the things, can be used for any other large-scale initiative that might be a care model as well. So thinking about the care delivery system, and then acknowledging and thinking about what is the performance improvement methodology used in the organization. We don't have to be prescriptive about that. We know that our members across the nation use lots of different models, high reliability, PDSA, all different things that they can use. And so it's fine for them to use that model. And then to involve the patients and the caregivers, right? That's critical because all of this is work being done to improve life. And we really thank Northwell Health for the amazing work that you've been doing, and specifically to Michele and Susan for their great teamwork and the example they've been able to share with you today. If you're interested in getting involved in Age Friendly, please go to the AHA Age Friendly website and you can sign up for the action communities. Those are free. There's no cost to them. Both the American Hospital Association and the Institute for Healthcare Improvement share the action community activities. We do one that starts in the fall. The Institute for Healthcare Improvement starts theirs in the spring. They are the same. We stay very closely aligned so that the members can make their choice based on their strategic plan and what timing works best for them. So please consider joining one of them. We have lots of case studies and information on the website, and certainly you will see Northwell there. Thank you so much for your time today and for all that you do.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.